Welcome to the final episode of our series with Dr. Ginger Martin. I'm your host, Envy. Thank you for joining us today. Let's dig into therapy. What types of therapy options available for children on autism spectrum? And are there specific approaches you recommend?
Yeah. So, one of the first resources, depending on the child's age, would be to access early intervention. So, 0 to 3 programs can provide speech therapy, occupational therapy, developmental therapy, physical therapy, depending on the child's developmental needs. And there's also outpatient services that provide that as well, and they have different criteria for um, criteria to meet qualification to receive the services. So outpatient services are another fantastic option that can provide the same, physical therapy, occupational therapy, and speech therapy. Um, AVA services or wraparound are really, really helpful, especially with an autism diagnosis. These are services that truly provide an intensive amount of service to the child in the natural setting. So they can come to the home, they can go into the school setting, and they are working with the child on, whatever the goals are, whether it's language, social, behavioral, sensory, and can really help to make rapid progress. So those services are often recommended as well. Social skills supports are available, whether it's an outpatient group or through schools. So a lot of schools will provide social skills support, but there are also some outpatient groups that will provide it as well. Outpatient mental health therapy, so something like cognitive behavioral therapy, is a great option, again, for individuals who are a little bit older or perhaps on the more mild end of the autism spectrum and could benefit from more of the CBT strategies. And then, of course, school based services. So once a child has the diagnosis and that's shared with the school, it can be integrated into either a 504 plan or an IEP, which opens services to be provided in the school setting. And that can start as early as age 3, once children graduate from the early developmental 0 to 3 programs. They could start with an IEP at age 3 to 5.
We do see some schools offer services, but often they are not enough. At what point should parents seek additional help from outside the school?
Yeah, absolutely. So schools can be an enormous resource and oftentimes can provide a wealth of services and supports for the child. And so um, I think that it's something that varies, from child to child. But it's always available to add the additional services or to just have an evaluation for them. So your child is getting some speech therapy at school, but we feel like, okay, that's maybe 30 minutes a week, and we'd like to add to that just to make sure that we're really addressing it. The nice thing is that, the school-based services are going to be looking at educational needs as a primary goal. And so outpatient services are looking at the child in a more, holistic way. They're looking at all of the needs in terms of, speech language, development, or physical therapy, occupational therapy. And so sometimes we'll have, say, the school is providing occupational therapy to work on fine motor skills as it pertains to writing in the classroom. And an outpatient occupational therapist may be able to work more on sensory needs. So we can see that each service can provide something a little bit different or can just enhance. I always say it's great to have multiple people kind of working on the same thing with your child if they're really struggling with speech, because each one has a slightly different approach. Even it happening in the classroom versus going to a clinic could be, a different experience for the child and can prevent different benefits. So I think it's sort of a case by case in terms of what the school is already providing and how the child is doing. If we're continuing to see struggle, then those outpatient services are always a great addition. Um, and so it can always, add a more full and well-rounded sort of therapeutic approach.
One of the common things we notice is families who can't afford additional help or struggle to access resources. What are the some free or low cost options you recommend?
I am licensed in both Pennsylvania and Florida. And so they're slightly different in each area as they are in many areas across the country. So in Pennsylvania in particular, if a child has a diagnosis of autism spectrum disorder, they can often qualify for medical assistance. And so medical assistance then becomes sort of a secondary insurance and often will cover a wide range of services with no copay. And so that's an enormous benefit to families in Pennsylvania. So that can help a lot with accessing services, including wraparound and outpatient services as well. So that's definitely something too that I share with families and will advocate for that to get connected through. In Florida, there are some different avenues for resources in terms of funding and educational funds that are available, as well as waiver funds that are available. So it's helping families to get connected to that. In addition to that, I always mentioned, speak with the insurance company and ask which providers are in network and, what are the copays so that they have all that information ahead of time. Um, and then also going through either early intervention or the school district where services are provided, with no cost.
You mentioned a very key point here, talking to insurance and other avenues, and that's something a lot of parents don't know, and we miss out a lot on that.
And just one other point with insurance is it's also good to kind of ask what your out of network benefits are. Because sometimes if a provider you want to go see is not in your network, there may still be some coverage or you can get some special accommodations. If you have the conversation and you call and talk to the provider, sometimes they can work things out. So it's always a good avenue to talk directly to the insurance company and see what your options are.
That is good to know. We are learning a lot of new info, which otherwise is difficult to get at one place. In some cases, we see more than one kid needing special needs services, and it's often overwhelming for parents. What are some techniques you can suggest so that they can balance this very well?
Sure, absolutely. And it can be common to have more than one child with either an autism spectrum diagnosis or maybe another neurological or neuro diversity that's happening in the household. And so, um, for sure, that can create a very taxing and stressful, overwhelming parenting dynamic. And so, it's definitely important that parents seek support for themselves as we're talking about the myriad of services available for their child. And there can be parents that have, a very detailed schedule of appointments for the child to make sure that all their needs are met, which of course is important. However, making sure their needs are met is equally as important. So I do think having their own, therapist to talk to is an enormous resource that can really help just to provide even just an hour a week of time to unload some of that and to kind of talk about the stressors and to acknowledge how difficult it can be and also how rewarding it can be. But for sure, having that support can make a huge difference in being able to. I always think of it as sort of emptying a little bit out of the cup, so that you have more room, you have more tolerance to manage the demands. This can really, I think, also kind of leaning towards other supports in the family for respite. So have, a grandparent or an aunt or an uncle, uh, or even just, a babysitter who come over and um, allow the parent to have, some uninterrupted time, even if it's going to the grocery store or going to the gym or taking a walk. That could be really helpful too. And not every family has that support. And so I think building a community is really helpful in those situations as well.
You're right. A lot depends on how they take care of themselves and take care of loved ones. Lastly, if there is one piece of advice you would give to parents listening right now, what would it be?
I think the one piece of advice that's most important is just to remember that you know your child best. If you have questions, if you have concerns, if something just doesn't feel right, it's great to seek a consultation, talk with your pediatrician or talk with, a professional who specializes in these areas. You want to trust that you know what your child needs. And I think that carries over into treatment as well. If your child is working with a provider that you don't feel like is the right fit, or you're not feeling like they're making progress, or you're sitting at a school meeting and have, questions or concerns, to really trust yourself and advocate for what you know your child needs. So I think that's probably one of the best pieces of advice is just to really trust that instinct as a parent and remember, you are the expert on your child.
And we came to know about a event that you recently did, Breathe Again. Can you tell us more about it?
Yes, absolutely. So, one of the things that I really enjoy doing is providing workshops. And so, this one recently was um, for moms to kind of learn a little bit about the mental load of motherhood and stress management. So not specific to having a child with a special need, but certainly it would apply to that for sure. So this has become an area that I really enjoy focusing on is that parent stress level, maternal mental health, and just advocating for self care. And teaching a little bit more just psychoeducation about stress, about anxiety, about the toll it can take and about simple strategies and tools that can be used every day that don't have to take a lot of time, but that can certainly address the stress levels that any parent feels, and for sure, those with a child with special needs or an autism diagnosis.
That brings us to the end of our three-part series with Dr. Ginger Martin. We hope this has been an insightful journey for all the parents and the caregivers out there. If you're feeling more informed and ready to navigate your child's development with a confidence, we are so glad to have been a part of that. Thank you so much, Dr. Martin, for sharing your wisdom with us today. To our listeners, don't forget like, share, and subscribe to INS podcast. And if you want to learn more about Dr. Martin's work, check out the links in the description below. Until next time, stay informed, stay strong, and keep learning. Thank you.